Mesh surgery in urogynecology have been filled with a lot of misconceptions and misunderstandings. So in today's video, I'm going to clarify what is a myth and what is a fact regarding mesh surgery. Hi everyone, I'm Dr. Nabila Noor, board certified and fellowship trained urogynecologist and a pelvic reconstructive surgeon. Welcome back to the channel. Here we talk about everything pelvic health. So if you like what you see, don't forget to subscribe and share it with a friend. So what's the deal with mesh surgeries and why do we use it? So mesh essentially is a material, right? So here are a few examples of mesh that we use for patients who are suffering with urinary incontinence, with laughing, coughing, sneezing. So that's the sling procedure that we do, which is essentially this material right here, and this light right here is the single incision sling. We also use a larger piece of mesh for patients who are suffering with pelvic organ prolapse. So one of the most common surgeries that we do, in fact, one of the gold standard surgeries that we have for patients with advanced stage prolapse is something called a sacrocolpopexy, where we put a Y mesh, because it looks like the alphabet Y, inside the patient's abdomen to help suspend the pelvic organs. Now, traditionally, we used to use mesh for vaginal prolapse repairs, but we don't do that as much now because of a lot of the controversies that happened in early 2000. So let's do a little bit of history lesson. So early in 2000, in the United States, there were a lot of controversies about mesh because patients who were getting a lot of surgeries with mesh, whether it be for prolapse or incontinence, were complaining that afterwards they noticed a lot of pain with intercourse. There was a lot of scarring. Patients were getting a lot of infections. The mesh thread was essentially coming through the vaginal tissue. And yes, some of those were correct, but a lot has changed in the last 2 decades. Primarily, the quality of the mesh is very different than what we used to use in the early 2000s. Most of the mesh that we use now are known as type 1 polypropylene mesh. We call them lightweight. And what that means is that the mesh is very light. It's not very heavy, so the density is very low compared to some of the older generation of mesh. The pore size of the mesh material is very wide, which allows the body's immune cells to pass in and out so that they don't get trapped in this mesh once it's inside the body and cause infections. Early in 2000, the kinds of mesh that we used, they were a lot more varied. And the reason for that is, at the time we used to think that the stronger the mesh, the denser the mesh, the better, because it's going to hold up the pelvic organs much better. Now, it is true, the denser mesh is stronger, but a dense mesh is not necessarily something that the body appreciates, and there's a much higher chance of our body rejecting those materials, and also the mesh material migrating into other organs such as the bladder or the bowel or coming out through the vagina. So we used to hear a lot about complications such as pelvic pain, scarring, the vaginal meshes coming out through the vagina or going into the bladder or the urethra, or women having a lot of infection because the mesh has caused irritation of the bladder wall. All these concerns by patients led to a lot of lawsuits. So the FDA got involved, and over the last 2 decades, there's been a lot of research, there's a lot of investigation, there's a lot of vetting that has got into meshes. Essentially, the FDA wanted a lot of the surgeons who are doing these surgeries to look into their patients' data, look at why these were happening. So we have learned a lot from this whole process. Number one, the quality of the mesh makes a huge difference. And as I mentioned before, all the meshes that we use now are type 1 mesh, lightweight, polypropylene. All this has helped improve some of the complications we used to hear about. Number two, urogynecology became a board certification because we realized we need specialized surgeons with the right amount of training, with the right kind of experience to be doing these very complex surgeries so that patients don't have bad outcomes. So early in 2000, pretty much anybody who mentioned that they could do mesh surgeries were allowed to do it. However, as these complications started arising, we realized that there need to be a more standardized way of doing these surgeries, and there has to be a lot more rigorous training that should go into it. So those of us who are board certified and fellowship trained and performing these surgeries in today's day and age, we have gone through additional training to be able to do these surgeries safely. This is all I do every day, and I know all my colleagues who are urogynecologists or have training in female urology, this is what we do, and that has significantly improved outcomes. This is one of the most common concerns that I hear from my patients when they come to see me in the office, because I do want patients to be aware of all the different treatment options, and inevitably mesh surgery comes up and they're petrified because they've heard all sorts of news, they've heard about lawsuits. And my goal with this video is to help clarify some of that misinformation so that next time you go see your specialist and ask them about some of the surgical options for yourself, you know what are some of the concerns and some of the questions you can ask to get the best treatment for yourself. If you haven't already, don't forget to subscribe to the channel, and I'll be back next week with another exciting topic regarding your pelvic health. See you soon. Bye.